Hi guys, hi everyone. Welcome to our show. Welcome to Migrants South. It's nice to have you guys again on our episodes. Let me first start by saying thank you to all of you guys for your continual support to our channel. For those who have already subscribed, thank you so much, guys. And for those who are really contributing in one way or another, thank you for your support and your comments. They are very uh, important to us, and we appreciate you guys to make time to watch our videos. So, in this episode for today, we are stepping away from home affairs, and we are looking into a new development that just happened, I think, last week. As you all know, the president signed a new law, which is a healthcare related law. It's known as the National Health Insurance, and that is the purpose to provide universal healthcare to everyone who lives in South Africa. And I'll clarify on that when it says everyone. And we're gonna look at that. We're gonna just look at the key elements of this new law and what it's going to be offering, who is concerned, who is applied to, who and who do not form part of it. Yeah. So we're gonna just try to highlight those few things so that my fellow migrants, you also aware of this new law and how it's gonna affect you, whether it's positively or negatively. So basically, as I said, the NHI or the National Health Insurance is I'm not I don't want to be talking. I'll just read the information as it is provided by the Department of Health, which says that the NHI is all about Ubuntu. All right. So in South Africa, when we talk about Ubuntu, we talk about humanity. You know, it's all about the new law. The new healthcare law is about humanity, and humanity in South African terms means they put it here. It says that we all take care of each other as a nation in times of need. NHI is the South African way of providing access to high quality healthcare for everyone. That's the text. That's the description that the Department of Health has given this new law in South Africa. So, as a human being, we all take care of each other and each other's needs in times of needs. Okay? And that for South Africa to show that it cares about humanity, it is this new law, this new healthcare law that is going to describe, that's going to demonstrate that South Africa is determined to ensuring that humanity comes first, regardless of what, regardless of where you come from, regardless of your origin or your race or your age or your gender. So this is a way of South Africa saying that we are a kind people. We are going to show that in our new healthcare law. Okay, so that's the new law that we've got from the South African government. So the question is, uh, will people be required to pay for healthcare under this new law? All right, that's the question. And what the Department of Health says is that initially there will be no tax for the NHI or for the National Health Insurance, okay, which is the new law. The government will pool the funds that already exist in the public sector to to start this new health insurance, okay. And when the NHI or when this national health insurance is up and running, then Treasury, okay, Treasury or the Department of Finance may now introduce a small tax so that they can get some funds to fund this new national health insurance. Okay, so basically, what it says that uh, 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 when this law gets underway, no one is going to be charged to pay for the health services that are provided by the hospitals, clinics that are operating under the government's national health insurance. Okay? However, the government has to has way to get the money that will fund these health services. In the beginning of starting these services, the government will use its own money to fund those services. But as time goes by, to strengthen the services, the government will need to get some money somehow. And the suggestion is that there could be potentially a tax, a small tax, as they put it, that will be charged for the government to get money to continue fund, to continue maintaining, improving this healthcare system that is provided to people free of charge. Okay. Now, the next question is to ask, what if you do not want to be part of, or you do not want to register, because people will have to register to this national health insurance. So what if you do not want to register for this NHI? So what they say that under the NHI, you will still have access to your preferred clinic or hospital. If you seek treatment in a facility that is not registered with the NHI, or if you do not wish to adhere to the referral pathways, your expenditure will not be reimbursed. This may necessitate that you pay cash or out of pocket for the service rendered by that particular facility. What does that mean? It only says that if you do not want to be part, or you do not register to join the NHI insurance, then if you receive services from any clinic or hospital, you might be required to pay the service that they render to you from your own pockets, because you are not registered with the NHI. So they're not going to force you to join. All right, you can register or you cannot register. It's your choice, and you're still going to have access. You're still going to be free to go to any clinic or hospital that you wish to go. But the only thing is that you're going to have to pay from your own pocket for those services that you are going to be given at that particular clinic. Okay. So the question is, what will happen between now and when the NHI is going to start? So from now on, that this NHI is now a signed law by the government of South Africa, but is not yet implemented. So what is happening now, from now until the time comes when this law is practically put into action? So what says before it can become a law? I think, okay, no, this section is already passed. So let's move the next section. This was before it became into law. So now it's now a law, and now it's going to be implemented, but has not yet started yet. Okay. Now let's look at how does it work. So how does this new law, this new national health insurance works? So the NHI will buy quality healthcare services on behalf of the people of South Africa. These services will be provided by healthcare professionals and providers in the public and private healthcare facilities, and will integrate them into one healthcare system that serves the needs of all South Africans. Okay, the NHI will combine the many public and private healthcare funds into one fund, and that will pay for everyone when they need to access healthcare, using the advantage of the size of the fund to reduce healthcare costs. So, in a nutshell, what does that mean? It means so South Africa will buy all the services that are currently rendered by private healthcare providers, your clinic, your private hospitals, all those will be bought by the government. All right. And then the government now will start paying these providers. All right. So that as a ordinary citizen of the country, you can go to any hospital, whether it's private or whether it's public, in your own area and get the service that you require from that hospital. And then the government will now pay those providers on your behalf. All right? That's the basic. And what the advantage of that is to be able to provide equal health care services to everyone equally, regardless of whether you are rich, poor, or whatever. So, this is a concept of a universal healthcare system that's provided to everyone free of charge, regardless of your social, economic, political, educational status. Who will the NHI cover? Okay, this is, I think, this is the most important question of this podcast. Who will this new national health insurance cover? This is a very, very sensitive question, especially with the experience of being in South Africa. Uh, yes, up to now, we receive free healthcare services from public hospitals here in South Africa. It might come that you contribute a small amount of money at certain facilities, at certain public facilities for certain services, but in its entirety, we still receive much of the services at free charge. Okay, and that in the past years, that has created many challenges and many obstacles to people like us, migrants or refugees, because locals started complaining, saying that we are depleting their healthcare facilities. We are depleting their resources, and they cannot longer get access to healthcare because we are just too many, and we go to those hospitals and we are full in those hospitals, and this and that and this and that. They can no longer get a seat or bed or whatever. At some extent, even some politicians or leaders, provincial leaders, got mixed up in some heated conversation when they used to say that if you go to the hospital today, you'll find that there are 10 people in the maternity, you find that 6 are foreign nationals and 4 are citizens. So yeah, that is why I'm saying this is a very sensitive question, because it's going to kind of raise the same questions that we had in previous years. And this is where I want to clarify one thing. And that's what I want to clarify, is to say that, look, this is, yes, it is under the South African government, this new national health insurance, but people have to understand that this is a worldwide trend. And it's not an initiative of South Africa, but rather an initiative of the United Nations, It's one of the main goals of the United Nations. And the United Nations and South Africa form part of the United Nations members. And therefore, they are all given the mandate to fulfill this goal in their own respective countries. And so, when South Africa implement this type of laws, it's going to reflect what the United Nations has has put forth, has suggested, and has guided their members to fulfill, which is that to provide universal health care to every citizen, to every human, not every citizen, but to every human being. And that is regardless of where he or she comes from, or regardless of the age, of whether it's a female or male, and of course LGBTQI plus and the rest, and whether you are from this country or that country. So that has to be clear that that is the aim of the universal health care. And let me say this clearly that yes, South Africa has started now implementing that. But citizens of this country, South Africans, have to understand that this is a global initiative, which means South Africa also wouldn't have had this initiative without having started from that side. And therefore, citizens of this country are going to benefit from this initiative because it started somewhere. So they should not take it personal to think that because it's being implemented in South Africa and because it's going to, of course, South Africans' working class is going to contribute towards this fund that will initially sponsor or support the system, that now they have to pay for people that are not South Africans who are going to benefit from this. So we have to understand that it's a universal healthcare and it's applicable to everyone who lives in South Africa, regardless of where they come from or their skin color or gender and so forth. So that has to be very, very key in understanding the objectives and the aim of these types of legislations. So, having said that, I will now answer this question, which is asked and is answered on this information provided by the Department of Health. Who will NHI cover? The answer is every South African, every permanent resident, every refugee, every prisoner will be able to register for NHI. So all this category of people, as long as they are registered on the NHI system, they will be covered under the NHI, the National Health Insurance Program. I continue of the people who will be covered under this law. All children born and living in South Africa will qualify for the NHI. All children who are born and lives in South Africa, regardless of whether they are from foreign parents or citizens. Everyone else will qualify for treatment for emergencies and diseases that can cause outbreak. When they say everyone else will qualify for treatment for emergencies and diseases that can outbreak. That refers to other categories of people. And here we are talking about asylum seekers, illegal migrants, and other categories, other people who are on other visas. We're talking about work visas, study visa. We're talking about visit visa and so forth. Okay? Note, those working for the SNDF will still have a separate fund. Here now we're talking about the South African National Defense Force. So these ones, they will be covered also. The soldiers will be covered under this NHI program, and they will still have their own separate fund because they are quite an entity that is at risk because they go to war and stuff. They can get wounded, so they will be covered under the NHI and plus additional fund that cover them. So let me I'm not, this is not finished yet, but for the sake of this first video, I'm gonna stop it here. I'll probably continue in the next video that will record for you and bring more clarity on that. But let me make it clear that this fellow uh, migrant, legal migrant, refugee, asylum seekers, this you should not panic. This you should not panic about this new law. You should not panic that maybe it's going to affect you. Maybe you're not gonna be able to receive healthcare when it comes into action. No, the law is clear. You are going to be covered. You are going to receive healthcare services. Perhaps there could be some differences in terms of what you can, what you cannot, but definitely there is going to be some sort of coverage here and there for those who are asylum seekers and who are illegal immigrants. They're going to be covered in some extent, but the citizens, the permanent residents, the refugees, all children, regardless of where they come from and where their parents come from, they are going to be covered under this new healthcare insurance program. So, guys, you safe, we are safe. I hope to continue like this, but as you know, things change. It could flip on the other side, but for now, as it stands, we are covered, and all we can say is to thank the South African government, and we can only pray that it continues this way in terms of healthcare services. So thank you guys for watching. I look forward to your questions. I look forward to your comments, and let me know if you need more clarification on this, and you can always provide that clarification. Cheers, and thank you for your support. Thank you for your likes, your subscription. Keep doing that, and we'll continue to bring you guys more information